Okay, so for this video, we're going to talk about the material in Chapter 14 on nutrition for pregnancy and breastfeeding, and we'll also talk about the information in the beginning of Chapter 15, which talks about nutrition in infancy. So for this video, we're going to talk about the negative effects of poor maternal nutrition, talk about nutrition guidelines in pregnancy, talk about changes that you can make to a meal to increase the folate content, evaluate mother's weight gain during each trimester, so the weight gain goals for the first, second, and third trimester pregnancy. Talk about the benefits of breastfeeding for mother, baby, and for society. Indicate practices of baby-friendly hospitals and describe appropriate feeding practices for infants from 6 months to 1 year of life. Interestingly, this is both related for both fathers and mothers. So we typically think of the maternal nutrition as significantly influencing the developing fetus, but it also relates to the men as well. So father's nutrition can affect sperm. For men, low body fat, chronic energy deficiency, that can decrease sex drive and sperm count. So the father's nutrition also can affect fertility. For both the men and women, excess body fat can decrease fertility, and losing 5 to 10% of body fat for those who are overweight or obese can increase the chances of conception. And so that relates to both the fathers and mothers to be. Also, the polycystic ovarian syndrome, also known as PCOS, it's a health condition that increases the production of androgens in women. So this is relating to women. There's a condition called PCOS. It increases specifically the hormone testosterone in women, which is the leading cause of infertility in women. It causes hormone changes that lead to insulin resistance, acne, facial hair growth, and so also for those who are overweight, women who also have PCOS, decreasing body weight 5 to 10% can significantly increases chances of conceiving. Low body fat, though, on the other hand, can also affect fertility. In women, this will lower estrogen production. So if one has a chronic energy deficiency and is underweight or has low body fat percentage, that can affect estrogen production, and it can lead to amenorrhea and a decrease in ovulation. So this will be more likely in someone who has an eating disorder, if someone doesn't have the financial means to have adequate nutrition. So in poverty, that can affect one's energy intake and energy status, or with excessive exercise, that can contribute to a chronic energy deficiency and hormone changes that would affect fertility. There is an ideal age range that would optimize fertility and healthy pregnancy, typically between 20 to 35 years of age. Teen pregnancies will actually increase risk for negative outcomes for both the mother and child. So infant mortality rate and also tracking low birth weight, these are all factors that are addressed in the Healthy People 2020 objectives, and there are two that have been stated in the Healthy People 2020 as goals. So currently the infant mortality rate is 6.7 infant deaths per 1,000 live births, and the target is to have a 10% improvement to 6 infant deaths per 1,000 live births. Also, there are goals related to low birth weight in Healthy People 2020. So there is a current, the baseline is 8.2% of live births with a low birth weight, and the goal is to improve that to 7.8%. So the definition of low birth weight is a birth weight of less than 5.5 pounds. This is typically associated with a preterm baby, so a baby that's born before 38 weeks of gestation. So if they're born earlier, then they've had less time to develop in the womb, and they are going to be at higher risk of being that low birth weight. However, if there's a baby that reaches full term who has low birth weight, so full term and less than 5.5 pounds, they are more likely to have medical complications than those babies that are preterm and also low birth weight. Okay, so here's an image of the placenta. So the placenta is an important tissue, an important organ that supplies nutrients and oxygen from maternal circulation. So you see the maternal portion of the placenta and the fetal portion of the placenta, and the goal of the placenta is again to provide nutrients and oxygen from maternal circulation to the developing fetus. We also see a diagram of the uterus with the placenta. We see the umbilical cord where the fetus is receiving nourishment from the maternal circulation, the nutrients, and the oxygen. So we see here the weeks of gestation starting at preconception, conception, and then all the way from the first trimester, which is to 12 weeks, and then the second and third trimesters up to 38 and 40 weeks. And you see the developing fetus and the stages of development. This diagram or this figure will show the different organs and tissues that can be affected from toxic agents and what period of development they would be more vulnerable to being affected by toxic agents. So the area with the blue bars would show the period of development where these tissues would be more vulnerable to being affected by toxic agents. So we see the nervous system, the heart, limbs, eyes, development of the ears, the palate, teeth, external genitalia. So we can see the development of these organs and tissues and portions of the body are going to be most vulnerable to being affected by toxins during the first trimester. So it's a very rapid period of development from conception all the way to the 12 weeks, and especially from conception up to 8 weeks, a very rapid period of development. And by 8 weeks, the embryo becomes a fetus. By 13 weeks, most organs in the body are formed. So nutritional deficiency or toxicity can potentially damage organ systems. So some agents that could be damaging include medications, certain vitamins, so especially vitamin A. We're going to talk about vitamin A toxicity. Can be what's called teratogenic, which is referring to something that can be damaging or toxic to the developing fetus. Radiation, trauma can also be harmful to the embryo. About half of all pregnancies miscarry during the first trimester. The quality, so during this time, the quality of the diet versus the quantity of nutritional intake is most important. So during the first trimester, it's essential and very important to get the essential vitamins and minerals to meet the elevated needs of pregnancy for women during this time period. In the second and third trimester, after the fetus has developed their organs and now they're rapidly growing in size, so they're increasing their weight and their lean mass and their fat mass during the second and third trimester. That's when the quantity of nourishment, so with the number of calories that is needed, will significantly increase for pregnant women in the second and third trimester. Okay, so we see the target weight gain for women during pregnancy, and it depends on their starting weight. So someone who is normal weight but prior to pregnancy, so that's a BMI between 18.5 to 24.9, the target amount of weight gain would be from 25 to 35 pounds. Someone who starts out at a higher BMI, so if they are overweight, that would be between a BMI of 25 to 29.9. Their goal weight gain would be less, so between 15 to 25 pounds. Someone who's starting out with obesity would have even a smaller target weight gain of 11 to 20 pounds. Alternatively, if someone starts out underweight with a BMI of less than 18.5, they would have a goal of gaining more weight than average, which would be between 28 and 40 pounds. It is very important to keep in mind that oftentimes during the first trimester, that is the period where there's a rapid increase in hormone levels. And these hormone changes can oftentimes lead to feelings of nausea, and women become very sensitive to smells and very particular with foods, and may develop food aversions. So weight loss may occur during the first trimester because this is the period where these hormone changes are going to be the most dramatic, and they may be most affected at this time by nausea and food aversions during the first trimester. So women may lose weight during that time, and so when talking about this weight gain, it is in reference to their starting weight. So if they lost weight during their first trimester, they would want to gain the weight back to baseline and then gain an additional 25 to 35 pounds as a target during the second and third trimester. All right, so this shows the weeks of gestation and the goal amount of weight to be gained between 25 and 35 pounds, and then it shows what that weight is composed of. And so we see a lot of the weight would be so the fetus, the placenta, amniotic fluid is going to be 11 of the 25 to 35 pounds. The fetus itself weighs about 8 pounds on average, but there's additional weight for the placenta and amniotic fluid. We have an increase in blood volume, so that would be about 4 pound increase in blood volume. Uterus and breast tissue, 6 pounds, and then additional maternal fat stores would be 4 to 8 pounds. During the second trimester, in preparation of lactation, women will have an increase of 2 to 4 pounds in breast tissue and a deposit of fat tissue. And so this is going to be in preparation for lactation and breastfeeding after the baby is born. In the third trimester, there's a period of rapid growth of the fetus. So in the third trimester, the fetus doubles in length and their weight increases by 3 to 4 times. There's a transfer of fat, calcium, and iron to the fetus during the last month of pregnancy. And because of this transfer of fat, calcium, and iron to the fetus may potentially deplete mother's stores of iron if the woman's intake of iron is low. And so you'll see in later slides when we talk about vitamin and mineral needs of women in pregnancy that their intake of iron is going to be higher. Their recommendations would be higher in pregnancy than in women who are not pregnant. A full-term fetus weighs on average 7 to 9 pounds and is about 20 inches long. Okay, so here we have nutrient needs in pregnancy, and so their needs will vary based on trimester. So we talked about the first trimester that the quality of the diet is more important than the quantity of the diet. So during the first trimester, again, we see this rapid increase in hormones that affects a woman and how they feel. So they may feel more nauseous, they may develop food aversion. So sometimes they have and experience weight loss, nausea, vomiting. So it's very important to focus on just getting enough nutrients through the food and also prenatal vitamins so that they're getting essential vitamins and minerals to support the rapid development of the fetus during the first trimester. It's in the second and third trimester where women's calorie intake will need to be higher. So the calorie recommendations increase in the second and third trimester. So it would range between 350 to 450 extra calories per day. Also, carbohydrate needs will be higher So in non-pregnant women, the DRI is 130 grams of carbohydrates per day. So in pregnancy, it's 175 grams per day. Protein needs also go up. On average, it's about 25 grams more protein per day is needed in the second and third trimester. It is very important to focus on nutrient-dense food to support the intake of all essential vitamins and minerals. Having adequate weight gain during pregnancy, so gaining enough weight but not too much weight, is a strong predictor of good pregnancy outcomes. Okay, so how does this relate to a woman's weight gain in pregnancy? So we said that some women may lose weight in the first trimester, though some women will gain some weight in the first trimester. So to support a gain of 25 to 35 pounds, it's recommended to have the initial trimester to be a weight gain of 2 to 4 pounds. In the second and third trimester, it's an average of about a 0.8 to 1 pound weekly weight gain after the first trimester. What is interesting also is if a woman is carrying twins, so her recommended weight gain would be higher. It would be 37 to 54 pounds for someone carrying twins. Okay, so we see here the recommendations for macronutrients and fiber, also water. So these figures are very helpful. They show recommendations for an adult female, recommendations during pregnancy in red, and then recommendations for breastfeeding. So we see a lot of these nutrients, the needs are elevated in pregnancy and with breastfeeding. So most notably, as we mentioned, needs for carbohydrates will be higher, needs for protein will be higher, needs for essential fatty acids will also be higher, as well as total water. So where breastfeeding is highest, or for breastfeeding, the nutrients that are highest would be total water. So as you can imagine, someone who's breastfeeding will be requiring more water to produce the milk. Okay, so here we see nutrient needs for vitamins for adult women, needs in pregnancy and breastfeeding. So most of these actually are highest in terms of breastfeeding, so needs are highest in breastfeeding, but a number of them will be increased in pregnancy compared to adult women. So ones that stand out are folate is particularly high for pregnancy, also vitamin B6, niacin, riboflavin, so these are B vitamins, also thiamine. So a little bit more on folic acid. So folate is very important to have adequate intake, especially during the first trimester and prior to pregnancy. This is the periconceptional period. Adequate folic acid supports development of what's called the neural tube. And in pregnancy, folate needs are 600 micrograms per day. Women of childbearing age require 400 micrograms per day of folic acid. And so getting adequate folic acid, again, supports development of the neural tube and closure of the neural tube. So you can see here a healthy spine. We have the vertebrae and the spinal cord, and then again the adequate closure of the neural tube. However, infants with spina bifida have an incomplete closure of the neural tube, and something that is called a condition called a neural tube defect. One most notable is spina bifida, and so that's an incomplete closure of the neural tube, and you can see that opening here, whereas a healthy spine, you see that closure of the neural tube. So having adequate folate will reduce the risk of development of the neural tube defects, specifically spina bifida. So what's interesting is in the US in 1998, there was a mandatory fortification of grains with folic acid, and this is because the need for folic acid is particularly high for pregnant women within the first trimester, so within the first 8 weeks of pregnancy. but sometimes or at times women are not aware that they're pregnant during this time, and so they do not know to take prenatal vitamins or to get adequate folic acid, which may increase their risk of the neural tube defects or spina bifida. So with the fortification of grains, that increase the intake of folic acid among everyone in the US, and this has actually translated to a decrease in the neural tube defects in the US since 1998, since the fortifications of grains. So it's decreased neural tube defects by about 30%. Vitamin A. Vitamin A is a key nutrient to address for pregnancy. So vitamin A is actually, we want to guard against vitamin A toxicity. This is a nutrient of interest because elevated intakes of vitamin A can be potentially teratogenic, again in high doses. So this can lead to facial and cardiac effects in the developing fetus. So supplements should not exceed 3,000 micrograms of retinol activity equivalents per day, and even increases more than 10% of the RDA is unnecessary. So we have the essential minerals and their recommended intakes for adult women, women who are pregnant, and then breastfeeding. So there are several that are needed in higher amounts in breastfeeding and pregnancy. So for breastfeeding, the needs are particularly high for zinc, manganese, iodine, copper, and chromium. In pregnancy, particularly, we see elevated needs of iron, zinc, and iodine. Iron, we saw that iron from the women, the pregnant woman, is transferred to the developing fetus, particularly in the second and third trimesters. And so it's especially important that iron intake is sufficient during this period of pregnancy. As part of routine check, iron levels are assessed in pregnant women during the second trimester to make sure that they have sufficient stores for the baby and that they do not have risk of developing iron deficiency anemia. So needs for iron are increased from 18 milligrams per day for adult women to 27 milligrams per day in pregnancy. Interestingly, for iron, the needs are much lower in breastfeeding as compared to adult women and pregnant women. And this is because in breastfeeding, up until especially 6 months on average, women who are exclusively breastfeeding will have what's called lactational amenorrhea. So they won't have their menstrual cycle, and so they won't have that blood loss on a monthly basis, and so their needs for iron are lower. All right, so we see here effects of low intake of iodide during the first trimester of pregnancy. We saw that needs were higher in pregnancy and breastfeeding as compared to adult women. So low intakes can lead to what's called congenital hypothyroidism, also cretinism, which is a condition associated with low iodine levels. This can cause mental retardation, the stunting of growth, impaired speech, hearing, and infertility. Also, it's important to not expose the developing fetus to alcohol. There are no safe intake levels of alcohol during pregnancy. With chronic high intakes of alcohol, it can increase risk of developing fetal alcohol spectrum disorders, with the most severe being fetal alcohol syndrome. This can lead to poor fetal growth, infant growth, physical deformities, and mental retardation. And so we see a picture here of the phenotype: small head circumference, what's called a low nasal bridge, small eye openings and eye folds, short nose, small midface, then upper lip. So this is going to be a potential phenotype, and symptoms may also include irritability, hyperactivity, short attention span, and limited hand-eye coordination. There are environmental contaminants that we'd want to decrease exposure to developing fetus, specifically mercury. So while it's helpful to have a fish that contain omega-3 fatty acids, which is the essential fatty acid, specifically it contains what's called DHA, which helps with the cognitive development, the myelination of the neurons. So we get omega-3 fatty acids from fatty fish, but it's also important to avoid certain types of fish that may have a risk of higher levels of mercury. So these would be specifically swordfish, shark, king mackerel, tilefish, also tuna. It's recommended to have less than 12 ounces per week of these fish and less than 6 ounces per week of tuna during pregnancy. Caffeine is another compound that you would want to limit in pregnancy. It may decrease absorption of iron, reduce blood flow through the placenta. If you have high intakes during pregnancy, that can lead to withdrawal symptoms in a newborn. So it can also increase risk of miscarriage in the first trimester specifically. It can lead to a higher risk of low birth weight, which we said again was less than 5.5 pounds. So it is recommended to limit caffeine intake to less than 3 cups of coffee per day. So these are specifically relating to recommendations for weight gain, so making sure to maintain a healthy weight before pregnancy and to gain an appropriate amount of weight so that you gain enough but not too much. Also addressing alcohol, so avoiding alcohol and that there is no safe level of alcohol intake during pregnancy. Also addressing to limit potential foods that may contain bacteria or toxins that may increase risk of foodborne illnesses that may affect the developing fetus, such as listeria. So reducing intake of unpasteurized juice, milk, also soft cheeses, deli and luncheon meats. Also making sure to avoid meat products that are undercooked. So to make sure to cook these foods to the recommended safe internal temperatures. For those who are breastfeeding, to wait at least 4 hours after consuming alcohol to breastfeed, because that will decrease the levels of alcohol in breast milk. And alcohol should not be consumed at all until breastfeeding patterns are established. Here are additional recommendations as it relates to micronutrients. So this is specifically relating to iron and folic acid. So women who are capable of becoming pregnant, to make sure to have adequate intakes of iron. Heme iron is iron coming from animal sources. Non-heme iron is coming from plant-based sources. Non-heme iron is less bioavailable. So to increase the absorption of non-heme iron, it's also recommended to consume non-heme iron with vitamin C, and that will increase the absorption of non-heme iron. Also recommended to consume at least 400 micrograms of folic acid, and then to get adequate amounts also from the food. For women who are pregnant, to increase intake of folic acid to 600 micrograms per day, and to take an iron supplement as recommended by a healthcare provider. For women who are pregnant or breastfeeding, to limit seafood to reduce the exposure of mercury, and to limit especially certain types of fish such as tuna, tilefish, shark, swordfish, and king mackerel that may have higher mercury content. So here are some overall cautions during pregnancy: to avoid smoking, to avoid dieting, to make sure to gain appropriate amounts of weight, avoiding herbal supplements that may contain compounds that may affect the developing fetus, also limit caffeine, and foods that may increase risk of foodborne illness. So to help alleviate heartburn, you can avoid lying down after eating and avoid spicy foods. Check with a physician regarding use of antacids, which may decrease symptoms of heartburn. For constipation, you can practice exercising regularly as long as that exercise you're cleared by a physician to exercise. Make sure to have adequate intake of fluids, about 10 cups per day, and adequate intake of fiber, about 28 grams per day. And also reevaluating iron supplements. Some iron supplements may increase risk of constipation. For nausea, up to 80% of women may experience nausea in the first trimester. This may be due to a heightened sense of smell, and we typically hear of morning sickness. However, nausea in pregnant women during the first trimester may occur any time of the day. So you want to avoid foods that may evoke feelings of nausea. Eat small, frequent meals. Eating bland foods may increase one's ability to eat. Also, taking vitamin B6 and ginger may decrease symptoms of nausea. For anemia, we mentioned how the mother's blood volume will increase up to 150%. Also, red blood cells will increase by only, so there's a lower ratio of red blood cells, which can lead to anemia, in addition to the higher needs of iron for the developing fetus. This occurs as a normal response to pregnancy. If levels of iron are too low, medical attention is required. So gestational diabetes is a form of diabetes that is temporary, only occurring during pregnancy. It occurs in about 4% of pregnancies, and during routine screenings in the second trimester, all women who are pregnant are recommended to have a test to evaluate if they have gestational diabetes. If someone has gestational diabetes, they are recommended to follow a low carbohydrate diabetic diet. Some individuals may also require certain medications to regulate blood glucose. So diabetes in the women will usually disappear after birth, but it may increase risk of developing diabetes again later in life. Okay, so we'll now shift a focus to breastfeeding, also called lactation. It is a physiological process. We have mammary glands that secrete milk, and there is involvement of hormones, specifically prolactin and oxytocin, that will stimulate the production of milk and then the letdown of milk during nursing. So what's important to keep in mind is that the production of milk is directly related to the stimulus from the baby. So when the baby nurses, that promotes the additional milk production, and the more the baby will nurse, the more the body will produce milk. And so reducing nursing will reduce milk production. So it's a demand and supply process. So again, with a higher demand and a higher stimulus will directly increase the production of milk. So again, lactation is an automatic physiological process with the stimulation from the baby, nursing, increasing milk production. Adequate support by family and healthcare team is crucial in a woman's preparation for breastfeeding. We have goals where we have breastfeeding addressed in Healthy People 2020. So we have the goals for breastfeeding addressed in Healthy People 2020. So targets for 2020 is to increase rates of a woman ever breastfeeding to about 82%. That a woman that is still breastfeeding at 6 months, to increase that to 60.6%. The rates of breastfeeding at 1 year up to 34%. The goals for exclusively breastfeeding for 3 months be about 46%, and exclusively breastfeeding for 6 months to 25.5%. It's also a goal to increase the proportion of employers that are providing worksite lactation support to 38%. nutrition during lactation or breastfeeding, there is a significant increase in recommendations for calories. So it's recommended that a woman who is exclusively breastfeeding to increase their calorie intake by 500 calories per day. There's also an increase in needs for fluids and various vitamins and minerals that we saw in the previous slide. In breastfeeding, there's an additional recommendations for higher intakes of carbohydrates in addition to total water. Other nutrients would be vitamin A, vitamin C, vitamin E, so these are antioxidant nutrients, also B vitamins such as folate, B6, niacin, riboflavin, and thiamine, pantothenic acid, B12, and choline. So most nutrient needs are elevated. Also, when looking at minerals, key nutrients addressed are iodine, chromium, copper, manganese, selenium, and zinc, with elevated needs during breastfeeding. And again, iron needs are actually reduced in breastfeeding due to what is called lactational amenorrhea. All right, there's variations in breast milk, and so based on the development and the age of the infant, the amount and quality of milk will change, which is really interesting, that the needs of the baby will affect the composition of the breast milk, which we'll talk a little bit more. Infant may be sensitive to allergens such as dairy, such as soy. That is unusual, but it can happen where a woman may need to adjust, for example, her dairy intake to any potential sensitivities in the infant. Breastfeeding also, because it does expend energy, it does take energy to support the production of milk, will support the weight loss of women who have had a baby and to get back to their pre-pregnancy weight. So we have different types of milk. So the first milk that will come right when the baby is born. So colostrum looks different than regular milk. It's a thick yellow fluid that's produced during late pregnancy and up to a few days after birth. It is very nutrient rich, containing antibodies, immune system cells, and lactobacillus bifidus factor. And so this helps with the immunities in the infant. It provides protection against infection and passage of the meconium stool. And then we have, once milk comes in after 2 to 3 days, we have different types of milk. We have what's called the fore milk and the hind milk. So when a woman first starts breastfeeding, so when they're having a breastfeeding session, when the infant is feeding, usually that will occur for about 10 to 20 minutes. So the first milk that comes within the first 5 to 10 minutes is called the fore milk. So that's going to be higher in carbohydrate and protein, and it resembles skim milk, so it's a lower fat milk. After the breastfeeding session goes longer, so after about 10 minutes or so, we have the hind milk that is going to be much higher in fat. So we see a higher fat content with lower of carbohydrate and protein. It resembles a cream even with containing higher fat, and this is going to be occurring later in a feeding. So it's recommended that instead of like switching from one breast to the other, so like feeding on one side for 5-10 minutes and then the other side for 5 to 10 minutes, that you actually stay on one side for longer so that the baby will get both the fore milk and the hind milk on that side. When should a woman not breastfeed? So in most cases it is recommended to breastfeed due to the high nutrient content of breast milk and the benefits to the baby and the mom. But in some cases it's not recommended. So for individuals with intakes of alcohol or illicit drugs, it is recommended that these stop, but if it's not, that it's recommended to not breastfeed. Also want to limit high exposures of tobacco and caffeine, especially for a woman who is smoking. It's recommended that they stop if they are breastfeeding. And certain medications. So medications are rated based on how they may affect the infant, and so they're actually given a grade A, B, or C. So you want to consult your physician before taking any medications, because that may enter into the breast milk and affect your infant. So again, there's a lot of benefits for the mother. So it helps to promote weight loss because of the energy required to support milk production. It saves costs because you don't have to pay for formula. It also saves time because it's convenient. You don't have to be constantly washing bottles, sanitizing bottles, packing up formula to bring with you. Reduce rates of breast cancer and ovarian cancer for mom. It helps with bonding with the baby and relaxing with the baby, and it also promotes self-confidence. Benefits for society. It helps with reducing healthcare costs due to these benefits for mother and for baby, and it has also been associated with factors related to a more productive workforce and protecting the environment. For example, babies who are not breastfed are sick more often and have more doctor's visits. Also, when you breastfeed, there are no bottles and nipples to sterilize. Also, unlike human milk, infant formula has a potential chance of being contaminated. There are several risks of not breastfeeding. So infants who are not breastfed, because the breast milk contains antibodies and immune factors, that those infants who are not breastfed are more likely to be sick. It's associated with a higher infant mortality rate, a higher rate of SIDS, with some studies supporting this, and a higher risk of diabetes, lymphoma, leukemia, overweight, obesity, high cholesterol, and asthma. And we also mentioned how infant formula has a potential greater risk of contamination. So we will now talk about a food plan for women who breastfeed. We said that the additional energy requirements for women who are breastfeeding is up to about 500 calories per day. However, milk production may require up to 800 calories per day, so that calorie difference contributes to a mother's gradual weight loss. We talked about essential vitamins and minerals needed in higher quantities with breastfeeding, so antioxidant vitamins such as vitamin A, C, and E, B vitamins such as riboflavin, also minerals including copper, chromium, iodine, manganese, selenium, and zinc. We do see a average weight loss post-pregnancy of about 1 to 4 pounds per month. We have a food plan here, so based on the higher energy needs and also needs for essential vitamins and minerals, we have recommendations for each of the food groups, so addressing calcium-rich foods, protein, fruit and vegetables, whole grains, healthy oils, and then a additional amount for solid fats and sugars. So want to have at least 3 cups of calcium-rich foods per day, about 6.5 ounces of protein, 3.5 cups of vegetables, and 2 cups of fruit. And you want to make sure that the fruit and vegetables will vary to get a variety of vitamins and minerals, 9 ounces of grains, and then 8 teaspoons of vegetable oils. So the growing infant, and we're going to shift now into nutrient needs for infants. There is a rapid rate of growth within the first year. So by 4 to 6 months, infants' weight will double, and by 12 months, their birth weight will triple. The length will also increase, so they'll increase in length by about 50% by the end of the first year. So if the average length at birth is 20 inches, then by the first year they will be about 30 inches. Also, they have nutrient needs for various macronutrients and micronutrients to support proper growth. So obviously we want to get enough calories, but also protein to support tissue growth, and then key vitamins and minerals, including calcium, iron, and zinc. These in particular will help support proper growth. Inadequate nutrient intake, including inadequate fat intakes, can inhibit growth. However, that is not typically a concern in the US. We have growth charts that show the typical rate of growth of the infant within the first year of life. So this actually goes up to the first 2 years, but we see here from birth to 12 months. This is a growth chart tracking weight and length. And so we see at birth, we see, and then up to 12 months. And this shows the various percentiles. So at the 50th percentile, we see at birth a infant weighing approximately 7 pounds, and then you see a rapid increase in weight within the first 3 months. So at 3 months, the 50th percentile would be about almost 13 pounds at 3 months. And then we see up to 6 months at the 50th percentile, the weight being about 16 pounds, and then continuing to, and then at 12 months, we see an average weight being about 20 pounds. Okay, so this is often tracked within the first year of life up and throughout childhood, but it is important to see if an infant who is growing tracks along the same percentile. If if they are tracking along the 75th percentile, but then their rate of growth will decline, and then they track on the 25th or the 10th percentile, that is potentially a concern. And we see the definitions here of underweight, overweight, and obese in children ages 2 to 20. So the definition of underweight is less than the 5th percentile, and then overweight is the 85th to the 95th percentile, and obese is at or above the 95th percentile. We see here the calorie recommendations for the infants for up to 3 months of age, 4 to 6 months, and then 7 to 12 months of age. This would equate to about 700 calories per day for a 6-month-old child. Up until 6 months, it is recommended to exclusively breastfeed and to not yet provide solids. That breast milk and formula would provide sufficient kcals up until 6 months of age. Infants have relatively high energy needs due to their rapid growth and rate of metabolism, and this is also related to their high body surface area. You can see here the calorie content of various types of milk and formula. So we see human milk as compared to whole cow's milk or fat-free cow's milk. So the calorie composition of human milk versus cow's milk is the same. However, human milk is lower in protein and relatively higher in fat and carbohydrate. So there are significant macronutrient differences between human milk and cow's milk, although the calorie amount is the same. And then you look at the comparisons with different formulas. So these are dairy-based formulas, soy-based formulas, and then transition formulas. So you can see all of the formulas except for that for the toddlers would be about the same calorie amount as compared to human milk and whole cow's milk. And then you look at the macronutrient composition is again fairly similar to human milk, with a relatively lower amount of protein and higher amount of fat and carbohydrate as compared to cow's milk. Micronutrients of special interest in infancy, we see vitamin K, vitamin D, B12. So for vitamin K, this nutrient helps with blood clotting. This is routinely provided as an injection at birth, and this will help with blood clotting for infants until they are able to build up their own stores. Vitamin D levels are reliant on maternal vitamin D, and then at birth, the infants and children should consume 400 international units of vitamin D per day. Breast milk is lower in vitamin D as compared to this recommendation. So for infants who are breastfed, it is recommended that they have a supplementation of vitamin D, or if they're consuming less than a quart per day of formula, that they also get a supplementation of vitamin D. Vitamin B12 is an essential nutrient. However, B12 is derived from animal products, and so breastfed infants whose mothers are vegan, they're not consuming animal products, so they're not getting, they may be getting insufficient B12, and therefore there would be lower B12 in the breast milk, and so breastfed infants should also receive B12 as a supplement. Now we have minerals of special interest in infancy, so we have iron, zinc, and also some notes about fluoride. So iron stores are depleted by 4 to 6 months of age. The initial levels are from maternal iron. Iron fortified formula is recommended for bottle-fed infants. Iron supplementation may be recommended for breastfed infants. At 6 months of age, we have the introduction of solid foods, and so some may be iron fortified to ensure adequate intakes of iron among infants after 6 months of age. Also, zinc and iodide are essential nutrients that can be supplied by breast milk or formula. Fluoride supplementation is not recommended before 6 months of age. It is recommended to use fluoride-free water in the preparation of formula prior to 6 months of age. However, after 6 months, it may help with tooth development. The fluid needs for infants are about 3 cups per day. This can be provided through breast milk or formula, so these needs are met through regular intake of milk. Supplemental water is not recommended during the first 6 months. So in addition to vitamins and minerals, breast milk will also contain immune factors that's first present in colostrum and continues in the breast milk. What is very interesting is that these factors will change based on the exposure of the mom. So whatever she is exposed to, and therefore the baby's exposed to, the different antibodies and immune factors will change, and that will be passed on through the breast milk. It is important to note that breast milk does not contain the recommended levels of vitamin D especially, so supplementation for vitamin D is recommended, and the other nutrients may also need to be provided and or supplemented. So formula feeding for infants, so just straight cow's milk is not tolerated by infants, so it is not recommended to provide cow's milk to infants until 12 months of age. Cow's milk contains protein amounts that are too high, and also the mineral content is not suitable for infants. So formulas are recommended. They contain similar macronutrient composition as breast milk, and formula manufacturers must follow strict quality control guidelines to ensure the safety of formulas for infants. They are fortified with vitamins and minerals to match the vitamin and mineral content of breast milk. However, formulas do contain higher amounts of vitamin D than breast milk. The formulas are largely cow's milk based, containing lactose and sucrose, casein, whey, as well as vegetable oils. So by 6 months of age, it's recommended to introduce solids, to begin introducing solids to infants. There are a number of considerations to keep in mind. So the nutrient needs of the infant, as well as their physical readiness, and also being aware of detecting and controlling any potential allergic reactions. So it is recommended to introduce single ingredient foods at one time. So single fruits, pureed vegetables, pureed rice or oats. So only single ingredient foods at a given time initially are recommended, because if you provide multiple foods at once and the infant gets an allergic response, then you're not able to detect what they are potentially allergic to. Here are various tips. So with time, you can introduce and practice self-feeding skills to allow infants to practice that hand-eye coordination and to develop the motor skills needed to self-feed. You want to use a special spoon that would be specific to the size of a baby, that would be smaller. You can hold the infant on your lap or have them in a high chair to be comfortable when they are feeding. You first introduce a small amount of food on the tip of the spoon, place it on the tongue, and allow them to feel it in their mouth, and to eat small amounts slowly, to just introduce the texture and the taste of that food. You want to have a calm environment and a calm demeanor so that they associate a calm environment with their feeding. And initially, you would expect an infant to only take a few bites within their first meal, so they're not going to be getting sufficient nourishment or significant nourishment with the initial introduction of food. It's more to expose them to new flavors, new tastes, and new textures. So the foods that they are first going to be introduced to, you want to have variety, balance, and moderation. You don't want anything to be super rich or high in fat. So again, mostly pureed grains such as oats or rice, pureed fruit, vegetables, but again, exposing them to a variety of foods one at a time. Foods that you would want to omit, so things that would be containing added sugar or sugar alcohols, also canned foods, and also honey that may have a higher risk of containing Clostridium. So this first year of life is so important, and their nutrition and their nourishment is a significant component of their first year of life that affects their ability to grow and develop. You want to encourage healthy eating habits, avoid added sugar and concentrated sweets such as juices, fruit juices, milk with sugar, and also encourage physical activity. One thing that can occur is something called nursing bottle syndrome that you would also want to avoid. This is when one would provide a bottle to an infant in the crib, so they would be sleeping with a bottle in the crib and having the milk or even a sweetened milk that may be in their mouth while sleeping. That could greatly increase their risk of getting cavities and even tooth decay. So this concludes our slide presentation on Chapter 14 and the beginning of Chapter 15, addressing nutritional needs in pregnancy for breastfeeding women and also infants.